Hello everyone. The competitive exams are fast approaching. So today we are going to deal with the topic is pulses. Pulses, especially arterial pulses and venous pulses. In this part, we are going to discuss about the various questions that will come around for the competitive exams. So first, I'm not going to the definition or some theoretical part is regarding pulse. I'm just directly going into the competitive examination hints as well as some review notes regarding the pulses, which can be asked for your competitive exams. Okay. Now, the first thing is that regarding the pulse, we have to know there are two types of things are there. One is arterial pulses and venous pulses. First, we will deal with the arterial and the venous pulses. The types of pulses are mainly classified into basically into four types. One is pulsus alterans, bisferens pulse, pulsus paradoxus, and a dichrotic pulse. First, I will show you a picture regarding the uh, pulse. Okay, so that you can see the nature of this is pulsus alterans. First, we are going to deal with the pulsus alterans. The nature of pulsus alterans is that you have to think just a pattern of going up and down. Okay, two sequence will be there. S1 and S2, two sequence will be there. One will be going up, then it will be coming down. Again going up, again coming down. The main thing is that the question that can ask regarding pulses alterance is regular alteration of pressure in pulse with a regular rhythm. That is the main characteristic of pulses alterance. That means there will be a regular rhythm will be there. With that, equal one will be of the long head, another will be short. Again long, again short. Like that, a regular rhythmic pattern will be based. You can see the picture, how it is. It goes up, it comes down. Then it goes up, then again comes down. Then it's smaller one, then bigger one, then smaller one, then bigger one. That is the nature of. So regarding the pulses alterance, the question that can ask is regular alteration of pressure in pulse with a regular rhythm, single peak. That is very significant. Single peak. Okay. It is usually seen in LVF, that means left ventricular failure, may be seen in all conditions leading to LVF also. So, okay. So once a pulses alterance is there, you have to think of mainly two characters. One is it is a single peak pulse, and it will be having a regular alteration of pressure in pulse with a regular rhythm. The next thing is that is usually seen in LVF, and all the conditions leading to LVF you will get pulses alterance. Okay, keep this in your mind. So a question may be asked in this fashion: what are the which one is odd one out? That means that you will be given three sets of same the which is corresponding to pulses alterance, and one will be away from that. Okay, so the one can be it will be a single peaked one. The second one will be alteration of pressure in pulse with a regular rhythm. The third one, it can be maybe seen in all conditions of LVF, and the next option will be none of the above. Okay, or all of the above. Okay, if all of the above is there, you have to answer for all of the above. None of the above is there, such question will not come, because all of the above, there's such things. If such as none of the above such things are there, then you preferably you skip it off. That is will be better. Okay, so keep this in your minds. Pulse alterance, these are the three factors regarding them. Next, we will go to the bisference pulse. That is the second category is the bisference pulse. The characteristics of bisference pulse is the spelling of bisference pulse is BISFERIENS, bisference pulse. You can see the picture. It goes up to a peak, then at the half of the peak, it goes up, then it comes down. In the half, it again goes for a breakage for the next peak. That means two systolic peaks will be there. Okay, so by bisference pulse, you will have two systolic peaks. It is usually seen in aortic regurgitation, hypertrophic cardiomyopathies, etc. We can see such conditions. Okay, two systolic peaks will be there, seen in aortic regurgitation and hypertrophic cardiomyopathies also. You can see the pulse, the nature of pulse. It goes one for rhythm, then on the half it again splits up, then gives the next. So two systolic peaks will be there. That is the thing with the Besweren's pulse. Next we will go with the Pulsus Paradoxus. Pulsus Paradoxus means there will be normal decrease in systolic pressure during inspiration is accentuated. Okay, that means that you can see in the picture. It will be having going up and down, up and down, up and down, and up and down. You can see that one in the picture, how it is. Expiration, then inspiration, the same pattern. That is what is Pulsus Paradoxus. It is nothing but normal decrease in the systolic pressure during inspiration. Okay, then it is seen, which are conditions it is seen. That is very important. Pulsus Paradoxus is seen in pericardial tamponade, SVC obstruction, COPD, acute severe asthma, constructive pericarditis, pulmonary embolism, and hypovolemic shock. Okay, Pulsus Paradoxus is seen in conditions of pericardial tamponade, SVC obstruction, COPD, acute severe asthma, constructive pericarditis, pulmonary embolism, and hypovolemic shock. Pericardial tamponade, Pulsus Paradoxus can be seen in the options. It will be there, either pericardial tamponade will be there or SVC obstruction will be there. You can choose it and you can answer for the corresponding ones. So these four options are basically 4 questions regarding Pulsus Paradoxus. So Pulsus Paradoxus is seen mainly in, you should not forget, it is pericardial tamponade. That is the main one. The next one is SVC obstruction. The next one is COPD and severe asthmas. And also in constructive pericarditis, pulmonary embolism, and hypovolemic shock. In these all conditions, you will get Pulsus Paradoxus. Next is Dicrotic pulse. Dicrotic pulse, which is you can see this one. This is the Dicrotic pulse. One peak in systole and another in diastole. So you will get in the systolic pattern, you will get one peak. On the diastolic, again you will get the next peak. That is what is Pulsus Dicrotus or Dichromatic pulse. Okay, so we were studying Pulsus Alterans, Biference pulse, then Pulsus Paradoxus, and lastly we are studying Pulsus Dichromatus. Regarding Dichromatus, it has actually 2 palpable waves in systolic and 1 in diastolic. As 2 palpable waves are one in systolic and another one in diastolic. Okay, in the picture itself you can see how it goes. It goes one systolic, in the half of the systolic it again gives out another peaking out. That means diastolic phase it is giving out the next phase. 2 halves of the peaking you will get in case of Pulsus Dictatorus. Okay, sorry, Dicrotic pulse. It is otherwise known as Dicroticus pulse. Also, it is known as Dicroticus pulsus, Dicroticus, or Dicrotic pulse. Okay, Dicrotic pulse. Okay, Dicrotic pulse. Okay, is it clear? Dicrotic pulse. The word is and pronunciation is between. Okay, Pulsus Dicroticus or Dichromatic pulse. In this Dichromatic pulse, what you will be having is that 2 palpable waves in the systole as well as in the diastole will be there. Okay, next it is seen in dilated cardiomyopathies. It is seen in dilated cardiomyopathies. So we were studying 4 types of pulses. One is Pulsus Alterans, Biference pulse, Pulsus Paradoxus, and a Dichromatic pulse. Okay, Is it clear for you?